In this video study, the liver is seen below the costal margin. Here I am below the costal margin, and note that the angle is sharp. This is the liver angle, it is sharp. It has smooth outer margin, outer surface is smooth. एक लंबा सा लेके सा रोको, हाँ नहीं सा रोक लो. This is the portal vein showing normal dimension and is patent. Now this is the portal vein, and this is the hepatic artery in transverse section. This is the left lobe of the liver. Okay. This is the left lobe of the liver. This is the left lobe of the liver. This is the ligamentum venosum. This is inferior vena cava. This is the portal vein, and the portion between these is the ligamentum venosum and IVC is the ligament is the quadrate lobe of the liver, or the segment 1 of the liver. Now this is the middle hepatic vein. It shows sharp borders. This is the aorta, this is the superior mesenteric artery, this is the celiac artery arising from it, this is the splenic artery. This is the transverse section, in which this band of tissue is the pancreas in transverse section, because this is the splenic vein, this is the superior mesenteric artery with the ecogenic borders, this is the aorta, this is the IVC. So all these organs are normal. So in fact the liver, although now there are calculi in the gallbladder, भाई एक लंबा सा लगो, रोको. There are many calculi, among which this is the largest one, giving sharp posterior shadow. This is the gallbladder anterior wall. Always see the portal vein and the common bile duct when you see calculus in the gallbladder. The common bile duct measures 5.6 millimeters, is within normal, as up to 7 is normal. So the only pathology that relates to the gallbladder is the calculi, cholecystolithiasis, from other angle. You see, this is gallbladder because portal vein is at 90-degree angle to its neck. These are the calculi giving posterior shadow. This is the gallbladder. Now the liver is normal in ecogenicity and has a smooth, regular, homogeneous texture with normal vessels, patent and this is the IVC. This is the inferior vena cava. This is the aorta. So otherwise the liver is normal, shows no parenchymal echogenicity issue or now this is the diaphragm. The diaphragmic echogenicity is normal. Thickness is okay, weather normal. The liver has a smooth outer surface, normal echogenicity or echobrightness, homogeneous texture. So the liver is normal. Now note that there are two focal lesions seen in this liver. बाजी एक लंबा सा लवो, रोको, ना सा लवो, रोको, सा लेके जरा सा रोकने, खिंचो सा, this is one of them. This is well demarcated, evenly echogenic, rounded, bright, solid focal lesion. Why solid? Because there is posterior wall is clearly seen and there is no posterior wall shadowing or any other pathology seen. So this is a solid focal mass lesion measuring approximately 17.8 into 17.9 centimeters. 17.8 into 17.9 millimeters. There is yet another. You see posterior to near the diaphragm. You see another focal lesion. एक लंबा सा बाजी बड़ी मेहरबानी ए रोको एक नहीं खिंचो सा रोक लो खिंचो सा This is the other solid focal lesion. It is evenly echogenic. Okay. This is the right diaphragm, and this is the it measures approximately 25 millimeters into 22 millimeters. So there are two evenly echogenic focal lesions seen in the liver parenchyma. This is the one. Now if you concentrate, you will see that there are tiny tubular structures passing through it with no posterior shadowing, well demarcated, evenly echogenic. This is a typical picture of a hemangioma. So this is a hemangioma which is always benign in the liver. So this is hemangioma. The other one that was close to the diaphragm. This one. I have magnified the view. Now if you see that this is the first one that we were, focal lesion that we were seeing, that was evenly echogenic, well demarcated, with no posterior shadowing, wall shadowing. Similar appearance is that of this focal lesion that is adjacent to the right hemidiaphragm, this focal lesion. And what is this? Below the diaphragm, there is almost photocopy of this focal lesion here. You see, this is and here below the diaphragm you see a photocopy of the upper lesion. Again, doesn't it give an appearance of echogenic mass, evenly echogenic, well demarcated, and appearing a hemangioma just like this? So this is mirror image artifact of this focal lesion. This is called mirror image artifact of this focal lesion. So there are two hemangiomas seen in the liver, in the normal liver. Now, in every case of where you see a focal lesion in the liver, always concentrate on the outer surface of the liver, because patients with aggressive lesions will not have smooth outer surface, as you are seeing in this case. लंबा सा रोको बाजी रोकिया जी सा लैके रोक लो बदल थोड़ी मेहरबानी रोकिया नहीं जाता सा मुश्किल सा खिंचो रोको इथे एंड बस ठीक है. Now you see in both cases the outer surface is smooth, the liver echogenicity is normal, texture is smooth, homogeneous, diaphragm is fine, vessels were normal, and there was no other pathology relating to the liver except these two focal lesions that are evenly echogenic, well demarcated, with the posterior wall clearly seen, no posterior wall shadowing, and these are the hemangiomas. And in this image, this is the liver. Okay, this is a picture of hemangioma in the liver. And remember that you are seeing small tiny vascular areas within it. These tubular structures are vessels traversing into it. These tiny cystic area within the solid echogenic mass are the vessels in transverse section, and this is the mirror image artifact of this hemangioma.
Business